Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive right into a real medical detective story. We're going to follow the clues all the way from the emergency room to the deepest parts of the brain to figure out exactly what happens during a catastrophic event, a hypertensive hemorrhagic stroke.
So, this is the central question, right? What really happens? And we're not talking about a small leak here. We're talking about a rupture, a sudden, violent, high-pressure event that causes immediate and just devastating damage. We're about to see what that looks like, up close.
So, our story starts with a 64-year-old man. He's rushed into the emergency department and he is right in the middle of a massive neurological storm. The team has to figure out what's going on and they have to do it fast.
Okay, look at these signs. They are incredibly alarming and very, very specific. It's not just a little bit of weakness, it's a condition called hemiparesis, which means one entire side of his body is weak. He can't speak clearly, his face is drooping, he's losing feeling on that same side, and those huge red flags, the severe headache and the lethargy. And the key word for all of this is sudden. This all just happened, boom, all at once.
Now, the medical team has to make a critical call, and they have to make it now. Is this a blockage or is it a bleed? You see, they're both types of strokes, but you treat them in completely opposite ways. A blockage is called an ischemic stroke, but all the clues from our patient, the fact that it was so abrupt, that intense headache, the nausea, they are all screaming that this is a hemorrhagic stroke. A blood vessel has almost certainly burst inside his brain.
But you know, a strong hunch isn't enough when a life is on the line. The team needs proof. They need to actually look inside the patient's head. So they rush him for a non-contrast CT scan. It's the fastest way to get a clear picture of the brain.
And boom, there it is. The answer. See, on a CT scan, fresh blood is what's called hyperdense, which is just a fancy way of saying it shows up as bright white against the gray of the brain tissue. And you can clearly see this big white mass deep inside the left hemisphere. This confirms everything. It's an acute intracerebral hemorrhage. It's a bleed.
Now, here's where it gets really fascinating. With this type of stroke, the exact location of the bleed isn't just some minor detail. It is the absolute key that unlocks the entire mystery. The location tells us the cause, it explains the patient's symptoms, it tells us the whole story.
You see, bleeds that are caused by chronic high blood pressure, hypertension, they don't just happen anywhere. They have these classic, predictable spots deep inside the brain. And the most common location, by a long shot, is a structure called the basal ganglia, which is exactly where our patient's hemorrhage is. That is no coincidence.
So, now we know what happened, a bleed, and where it happened, the basal ganglia. Now we can finally connect the anatomy of the brain directly to every single one of the patient's symptoms. It all comes down to what that pool of blood is pushing on.
This image just lays it out so perfectly. On the left, you've got the normal setup. You can see the basal ganglia sitting right next to this super dense bundle of nerve fibers called the internal capsule. You can think of that as the brain's main data highway, carrying all the critical signals for movement and for sensation. Now look to the right. The hemorrhage is like a massive, catastrophic pileup on that highway. It's physically squishing those nerve pathways and completely shutting down the traffic.
And here's exactly how that works. When you compress the corticospinal fibers on that highway, what do you get? Weakness on the opposite side of the body, our patient's right-sided weakness. You squeeze the corticobulbar fibers, you get facial weakness and slurred speech. And when you put pressure on the somatosensory fibers, you get numbness. Every single one of his symptoms is perfectly explained by this compression. It's a direct cause and effect.
Okay, so we've connected the bleed to the symptoms. But that leaves the biggest question of all. What caused that blood vessel to rupture in the first place? And for that, the patient's medical history gives us the smoking gun: poorly controlled hypertension.
The best way to think about this is to imagine old, brittle pipes in a house, but with the water pressure cranked way, way too high for years. That constant, pounding pressure damages the walls of the tiniest arteries deep in the brain. The walls get weak and diseased, a process called lipohyalinosis. This can lead to these tiny, fragile bulges, almost like little bubbles, called microaneurysms. And then, one day, the pressure is just too much, and one of them gives way. It bursts.
So what are these specific vulnerable pipes called? They're known as the lenticulostriate arteries. These are really small arteries that branch off a huge major artery in the brain and then dive deep to supply blood to the basal ganglia. Their small size combined with the incredibly high pressure they're under makes them the absolute weak link in the chain. uniquely susceptible to damage from chronic high blood pressure.
So, after we've pieced all of this evidence together, the symptoms, the CT scan, the precise location, and the underlying cause, it all points to one clear, undeniable medical principle.
It's almost like an equation. When you see a patient with a history of hypertension who has a sudden neurological collapse, and the scan shows a deep bleed in the basal ganglia, you are almost certainly looking at a ruptured lenticulostriate artery. The pieces of the puzzle just fit together perfectly.
And this really brings us to the final and maybe most important thought. This absolutely catastrophic event, this brain hemorrhage, it didn't really start the moment the artery ruptured. No, it started years, maybe even decades earlier with high blood pressure, a condition that's incredibly common and frighteningly often has no symptoms at all. It's just a powerful reminder of how a completely silent problem can build up over time into a devastating storm. Which leaves us with the question, are we listening to what our bodies might be telling us?